The state of public health care took a back seat during the federal election. Now critics say Prime Minister Mark Carney needs to make it a priority once again. This, as a new report from the Fraser Institute shows that Canadian medical wait times cost almost $5.2 billion in lost wages last year alone. So for a closer look at the role Ottawa should be playing in the healthcare system, I'm joined by Melissa Prokopi. She's a Vice President of Policy and Advocacy for the Ontario Hospital Association. Welcome.
Good morning, Anne-Marie.
Canada has been ranked the worst in wait times of all high-income universal healthcare countries. Where does Mark Carney even begin on this problem?
Yeah, such a great question. I think, we have a huge opportunity right now as a country. Healthcare is really that common thread that unites us all, regardless of where we live, what our age demographic is, what our employment status is. It's something that I think we all kind of depend on. And if we do it right as a country, we can provide access to the right care to the right people at the right time. I think this is really going to be a kind of all hands on deck approach, the federal government, the provincial government, and providers kind of adapting and understanding what the healthcare needs of the system of the future are going to be. It's a real turning point for us as a country.
Yeah, we're used to thinking of healthcare as a provincial issue. I think COVID really changed all of that, and then we've been continuing down that path ever since. So what does the Canada Health Act say that every Canadian is entitled to, and how far away are we from that right now?
Yeah, I think access is always an important question. Equity is always an important consideration. Our population is growing dramatically as a country, and as it ages and grows, the healthcare needs are going to be quite different. So I think we need to think about, planning for the future. What is the evidence? What is the capacity we're going to need to be able to ensure equitable, universal, portable access for our communities? And it may look very different than what it is now, but I think thinking for the future is really the only way that we're going to be able to set ourselves up collectively to ensure that we can live by the principles in the Canada Health Act itself.
Well, and this is the ongoing problem that when we speak with healthcare providers, on this show in particular, we hear that how do we fix what's broken right now, but also prepare for the future? And that takes money. Part of the platform, the Liberals promised to add $500 million. This is to the Emergency Treatment Fund, which goes towards municipalities and Indigenous communities. And this is to help deal with toxic drugs and with overdoses. Is that kind of money enough?
I think the challenge is understanding where the greatest return on investment is in terms of how we're spending the money. And I think that's a starting point. I think there are so many areas of the system that we need to be thinking critically about for the future, how we support Indigenous communities, how we support mental health and addictions more broadly, how do we bolster access to primary care, which I know is a huge priority for both the federal government and the provincial government, I'll say here in Ontario, how we ensure we have the right access to hospital capacity across the country. Unfortunately, it's not a single solution, but I think collectively it's about understanding what are the needs going to be of our future population, and how do we make sure that we have the right composition of healthcare services to meet those needs. It may be different than it is today, so it's a little bit of managing what we have today and understanding how to push forward, but also thinking about how we might need to restructure and reorganize services for the future.
One of the things that you touched on earlier was, what some people could call the biggest barrier to change, and that's the relationship between the federal government and the provinces. So what needs to change on that front so that they can get to what you're talking about, which is not only fixing what's broken now, but taking care of the future?
Yeah, I think the federal government plays a hugely strategic and important collaborative role in provincial health systems. So both through the federal health transfer, but I'll also say we were really pleased as an association and as a sector to see huge commitments around hospital-based research and innovation, because investing in those types of initiatives not only helps bring researchers to Canada, but it also helps to source health-based research that serves all of us, provides benefit, whether it's future treatments, whether it's technology and innovation, whether it's brain science. That research is something that provincially we'll all benefit from. So I think continuing what they're doing, continuing to collaborate, continuing to work closely and to plan as a collective in terms of looking to the future and what we might need.
Melissa Prokopi with the Ontario Hospital Association. Thanks for coming on this morning.
Thanks so much, Anne-Marie. Pleasure.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.